My name is Robert Gabrys, and I'm a senior research and policy analyst at CCSA and the co-lead of our cannabis file together with Shay Wood. Where did the slides go? So before getting started, I just wanted to provide a little overview of who we are at CCSA and sort of what we do. So we are a national NGO organization that was created by an act of parliament in 1988 to address substance use and substance use issues in Canada. And we do this through three main strategies. So the first one is advancing research by synthesizing the available research evidence. The second is driving collaborations between partners across Canada. And the third strategy is ultimately to get the available evidence into the hands of people who need it most, which includes healthcare providers, policymakers, and people who use or are considering using substances. We have a number of different priorities and areas that we work in. Of course, cannabis is one of them, alcohol is another, opioids. We do quite a bit of work around stigma and substance use workforce competencies and have a pretty big portfolio around monitoring and surveillance. And here's just an example of one of our more higher profile projects that we released almost a year ago now, the Canadian Guidance on Alcohol and Health, which received quite a bit of attention both within Canada and internationally. Another one of our flagship projects is the Canadian Substance Use Costs and Harms, or CSUCH project, which is a partnership with the Canadian Institute for Substance Use Research. And essentially this is a large project that analyzes the costs of substance use across various different sectors or indicators, including health, criminal justice, loss of productivity, and other direct costs. And as an example of the cost for cannabis, so the total cost for Canada with substance use is $49 billion, and 5% of that was attributed to cannabis. For those who are interested in viewing this data a little bit more, it can be found on csuch.ca, and you could disaggregate the data by substance, by health, or other sort of domains, and you could look at the data by so substance, year, and then also province. We do quite a bit of research and work within the cannabis space as well, especially since legalization. In 2018, we received $10 million to support cannabis research and cannabis researchers within Canada, mainly to advance this area and to support the legislative review. Through various funding opportunities, we supported almost 60 projects. And knowledge mobilization was a big part for us, and we coincidentally produced 420 knowledge products and learning events, which included peer-reviewed manuscripts, reports, policy briefs, webinars, media releases, and various interactive online tools. And a big part of this grant was also to establish partnerships and collaborations between the community, the research community within Canada, not only during the funding period itself, but also long-term. So that was an important part for us. And ultimately, this research, sort of as I mentioned, was to support the legislative review, which we just noticed that a lot of our research was sort of cited within the What We Heard report that was released by the expert panel yesterday. And a lot of the research that we funded also informed our official responses to the consultations for the legislative review as well. And we used a lot of that research in our conversations with the expert panel during roundtables. We also use a lot of this research to support our public education campaigns. And this is just one of our more recent ones around pediatric cannabis poisonings, which stems from the work of Daniel Myron, who I believe is presenting tomorrow morning. And in terms of our website, so we produce quite a lot of different knowledge products, and a big piece of our work right now is to make this research accessible. So we're redesigning some of our cannabis web pages to make sure that everything that we sort of produced over the course of the 5 years is available within the same spot on our website, and that will be released soon. And in terms of some of the stuff that we're working on currently and in the future, so we've noticed that older adults have largely been an underrepresented and understudied population within cannabis research, especially during legalization. So to that end, we did a little bit of qualitative research within this area and are working on several reports and educational products for older adults. In terms of medical cannabis use, we are doing a few knowledge products within this area as well, just to educate people on the benefits and harms of using cannabis for medical purposes. We have a couple of systematic reviews currently ongoing around psychosocial and pharmacological interventions for cannabis use disorder. And we're also doing a large knowledge synthesis around the public health and safety impacts of cannabis legalization. There's been quite a lot of work within this space recently, and the focus for us mainly is really to identify some of the gaps remaining and provide some sort of recommendations for the future. And finally, we've been particularly interested in a standard THC unit and its potential implementation within Canada. We see a lot of value in this unit, both in terms of research, but also for consumer education and lower risk use. In October of last year, almost a year ago now, we held a stakeholder meeting around its implementation and its feasibility within Canada, and we noticed that a lot of people were pretty interested in it. So at our Issues of Substance conference next month in Vancouver, we're also presenting a panel on how we can move this forward within Canada. And on that note, our iOS conference is this November 20 to 23rd, 22nd. It's in Vancouver, and registrations are still open.